I think this idea about intentionality, which you just talked about, is so important. And Ruth, you talked about naming it. So naming it and saying intentionality around it is really good. And we talked about kind of the broken heart and the recurring thing that can get triggered so easily. So I think about this a meditation or a prayer, however you want to interpret it, that has been really powerful about directing our energies out at a time when maybe we focus too much on the in. But whole world. I am living to perform good deeds. I am living to improve myself for the good of all. Intention setting out and just kind of saying, okay, yes, I have my pain, I have my suffering, I'm also going to focus outward. And setting an intention like this at the start of the day or at the end of the day has been really powerful for kind of bringing, I guess, calming the spirit. We talk about calming the body, calming the mind. This is calming the spirit to, again, kind of direct us out and in a constructive fashion. And have a certain intentionality that can be very powerful.
Erin has a question.
All of these concepts and ideas, I think, are really powerful, but they're also very adult. Some adults have trouble with mindfulness, I'd say most. So it's a hard thing to do yourself as an adult when you're going through cancer. But what about kids or young adults who are dealing with cancer? How do you help them? How do these alternative therapies apply to them? A 2-year-old can't do yoga.
Can everybody hear? Can you hear what she's okay? She asked specifically about children. How can they do these types of things? How can a 2-year-old do yoga or acupuncture or some of these things? Do they translate at all to kids?
Well, yeah, so the question is, what about kids being afraid? Well, you don't talk about being a needle, but you're talking about acu-stimulation or something. But kind of a real fun thing is kind of soft belly breathing. Okay, we're all going to get on the floor together as a family, and we'll put your favorite stuffed animal on your stomach, and we're going to breathe, and we're going to watch you go up and down. And so kind of soft belly as you're breathing in, so the belly is nice and soft and fills, and then goes out. There's many fun ways of working this. Kids respond great to hypnotherapy. They don't have all these preconceived, kind of internal critics judging things like that. They respond well to aromatherapy. They respond well to ginger for nausea. They respond, so actually a lot of things really work quite well for kids. Maybe even better than adults because we become jaded and cynical and the like sometimes about such things, or we've been trained to think that if it's not a pill, it must not work.
There's always a little bit of marketing involved, how you sell, well, that's true for us adults too, but it can have a lot to do with how you sell something to a child. The acupuncture thing, don't focus on the needles. I prefer.
What if there are two?
Yeah, he.
Yeah.
Acupressure though, yeah.
That's true.
You need to poke them with the
Yeah,
needle.
exactly.
And most
I
of
was
the-
thinking outside the box, the adult
most
box.
of the children's hospitals have child life specialists and other staff that specifically know how to translate.
Well, they don't have this type of therapy.
What's that?
They don't have this type of therapy through children. No, we're part of the pain and palliative care program at Children's Hospital. And they do have a child life specialist, and I love her, and she comes and plays. So, and they have a music therapist, which my son didn't respond to, but we've asked about all of these and
Other hospitals. It exists as a profession.
One behavioral pediatrician in town, Tim Colbert, has had many years' experience. He graduated from medical school about 30-some years ago. He's been working on this. So there are people, and so they can be consulted by phone regarding approaches. And again, knowing Tim personally, his mission in life is to be helpful, and I think he wouldn't mind being able to share some insights that could be helpful for if a child's in suffering.
I might like to add as well that I only know what I experience with my own children, but even very little ones like to feel empowered and be able to feel like they're making choices, just like all of the things that we've been talking about for adults. I know my own children worked with my Healing Touch practitioner, even just for a few minutes sometimes. Oh, do you want to help me make your mom feel better? Or, if you don't feel good, we can do this for you. And for them to know that they could have some control and help themselves or help whoever is struggling was really huge for my young children.
I'm Carol. I worked at the University of Minnesota Hospital as an integrative therapy coordinator, and we brought in healing touch, massage, aromatherapy, acupressure, acupuncture for those children that wanted it, and they responded very well to all of it. Music therapy, guided imagery, they loved, and we have Care Channel on, and they use that all the time. So all of that works really well with children. They're just, some of them just said, they want it every day, healing touch massage or something. So they really respond very, very nicely to it, and it's available.
I'm standing right there. Should we do, sometimes I understand not everybody's comfortable like writing down a question and asking in front of the group. So I always think it's best to kind of leave the last 10 minutes or so. If you feel like approaching one of you, are you fine with that? Speaking face to face with humans? Awesome.
We'll get away from the microphones for that.
Yeah, it just is weird. It's just a weird thing. So, yes, hold on.
I just have one quick question for Dr. Plotnikoff. The $99 blood test you were talking about, was there a name for that?
Oh yes, it's a spit test. Yeah. Okay, and you can order it online. www.23andme.com. 23 is the digit 2, the digit 3, andme.com. You send them $99, they'll send you a spit kit. The spit kit, literally you spit into and send it back to them, register it, they'll process it. By law, they are not allowed to interpret the data, and that's fine. What you want is the uninterpreted raw genetic data set from it, which then you can upload to a variety of websites. The one I use is www.livewello.com. That's livewello.com. And I cannot tell you how profoundly powerful this has been for some people. And one of the reasons I left Alina was I said I should not be the only person doing this in all of Alina, Health Partners, Health East, Park Nicollet, North Memorial, et cetera, et cetera. And so my mission is to get more physicians trained, more psychologists trained, more pharmacists trained, more people, more health professionals trained, so you can work with an informed health professional on this. In fact, I'm leaving tomorrow for a genomics conference to actually further deepen this capacity. In town right now, there aren't all that many people who are doing it. However, if we look just at the P450s and the CYP enzymes, we talk about detoxification, there are many people who are very talented in this area and very knowledgeable, and you can actually find them relatively easy, or you could develop the skills yourself. It's taught in the dental school, other things. And I can't say enough because there have been so many people who have been, I hate to say, they've felt dismissed, denigrated, discounted, dumped because of the quote-unquote adverse drug reactions or not responding to drugs. And it's because It's their genes. They were born and they could not metabolize the things correctly. It happened to my own sister in her chemotherapy. It's happened to many patients I've seen. That's 20th century medicine. Next generation medicine is at least knowing how our detoxification pathways work. But at the same time, we can learn so much about many other pathways, including ones that can identify what is the ideal diet, ideal dietary supplements, and what things to avoid, including what medications to avoid from this. We can identify what are the metabolic barriers to being able to meditate because the mind is too restless, and the ways we can develop ways to bypass and detour around that. I could go on and on about this. Truly, within 5 years, it will have to be the standard of care because there's going to be too many malpractice cases because the knowledge is readily available, and by far and away, the public knows this better than the health professions right now. And so, but that should be changing fairly quickly. So, the nice thing about 23andMe is you own the data, not the health system. If you don't want it to go into your chart, it doesn't go into the chart. You own it.
All right. I want to thank everyone on the panel. Thank all of you for coming. Thank you for your questions, for your patience, and just for being rad. Thanks.
Jenna, thank you for being here.